In Mississauga, healthcare workers are holding a press conference today on the state of medical care in Gaza and what the Canadian government can do to help. Faiza Amin is standing by on Dundas Street. Faiza, what can you tell us about the plan for today?
Well, Melissa, a group of medical professionals, among them doctors, are urgently calling on Prime Minister Justin Trudeau to intervene and prevent the further loss of life and devastation in Gaza. So these medical professionals, which, by the way, some of them are here in the building and are getting ready for this morning's press conference, they brought with them a list of demands for the federal government. What they say is a crisis happening in Gaza. So according to the Gaza Health Ministry, the Palestinian death toll has climbed to over 9,000, and over 3,700 of those deaths are said to be children as airstrikes continue and as Israeli troops are advancing towards Gaza City. These demands are coming in from these doctors, and a list of them here. The first one for Trudeau to advocate for an immediate ceasefire between Hamas and Israel. The second is that they're urging the Egyptian government to open up the Rafah border and for the enforcement of the Geneva Conventions. They're calling for the protection of hospitals from airstrikes, and they're also calling for an immediate stop to, quote, collective punishment in Gaza. The organizers say people in Gaza are actively prevented from accessing medical aid, and hospitals and civilian infrastructures have been severely damaged. They say that this is exacerbated and prolonging the suffering of innocent civilians, including children. I just spoke with Dr. Anas Al-Qasim, who you're going to be hearing from later today. He's set to speak at this press conference. He has spent time in war zones and knows the scary realities that come with that. Take a listen to what he had to say.
So the situation in Gaza is unprecedented. We have been communicating with the doctors on the ground. And not only some hospitals have been directly or indirectly bombarded, but the cut down of electricity, water, and fuel has caused many hospitals to shut down. The World Health Organization has said that a third of the healthcare facilities are not operational for now. So this is really a dire situation, and we are here to ask for a ceasefire and to allow the medical supplies and the fuel and electricity to come back to these hospitals.
And Dr. Al-Qasim also tells me that he was at one point in touch with over 20 physicians who are working in a couple of hospitals down there. But the last few days, because of the communication blackout, he has not been able to get in touch with some of them. So he does not know whether or not they're safe. And something troubling he mentioned to me, Melissa, is because there's a limited supply of medical aid coming through. These doctors are treating patients, some of them amputees, without anesthesia and in the hallway. So they're looking for the Canadian government to urgently listen to these demands.
Oh, that's horrifying, and so notable that the focus here is on the medical community reaching out about this going on overseas. You touched on it a little bit already. What more can you tell us about who is going to speak today?
So you're going to be hearing from a number of medical professionals, and by the way, over 2,000 of them are supporting the demands and the calls that are going to be listed out here today. So you're going to be hearing from doctors who work in hospitals, family physicians, clinical professionals as well. And I'm being told one of the speakers here today has actually been to Gaza a number of times and has seen the horrifying realities there. And so you're going to be hearing from the group on the urgent healthcare challenges and the realities on the ground in Gaza. So again, this press conference set to get underway at 11:30. And Melissa, we will be here in Mississauga. We will bring you the latest tonight on City News.